Our goal is to build 10 primary care clinics that will have an enrolled patient population of 30,000 people and will be supported by a multi-specialty clinic and 30-bed acute care hospital. We will then duplicate the model in as many locations as there are willing patients and providers that we can enroll in our patient-physician cooperatives and accountable care organizations and the employer and government-sponsored health plans. Our mission is to lower mortality and morbidity rates while operating profitability and feeding back the surplus profit into the system to continuously improve care. Neighborhood-based primary care clinics and multi-purpose surgery centers, urgent care, labs, and doctors' offices in a program called Total Healthcare System. Finally, for the patients, our goal is to create a continuous healthcare system that is accessible, comprehensive, and coordinated. Having a place that gives us the ability to educate, inform, and enroll on-site any prospective patients. Each primary care clinic location will have meeting and educational space in their neighborhood. Create relationships between families within a community so that they share a common interest in their health, the environment in which they must live and work, and the appointment and support of healthcare providers who will make health better for each family by their advice and treatments. The number of individuals in this circle should grow to about 3,000 patients who are helped by about 10 healthcare providers, of whom 6 are community health workers, 3 are nurses, and 1 is a primary care physician. All must be very well trained in community organization and basic health care, and they must continually teach the patients in their meeting hall and in the homes of each patient. The most important aspect of this circle of support is that the healthcare providers know each person by their name and their relationships with a protective eye and a caring manner. What will follow the creation of this community are the physical facilities and communications technology that make diagnosis and treatment for sicknesses and injuries both better and safer. This work is made possible because the money now available for healthcare is about twice the amount that is actually needed, and the delta between the premium and a fair price is available to reward the capital investment, the labor for services, the rent for facilities and equipment, and substantial rebates for the patients. A healthcare system built on the paid membership of patients will thrive in a market in which access to service is complicated, difficult, and expensive. When patients know their doctors and the doctors serve a stable population that pays them better than the current insurance system, then the quality of care improves and the cost drops. The saving for patients is more than 30% when compared to the current insurance system. Patients and doctors in this kind of a cooperative can afford to pay for the best kinds of facilities in which they can get the safest treatments and care. The developer who helped this system grow and provides the facilities will profit. This is replacement technology and a patient-centered healthcare system. Profit margins come from the huge differences between the waste and damage caused by the current healthcare delivery system and the replacement system we are building. Contracts with 600 physicians as their agent. Control of open EMR. A completed ACO application. Contracts with 4 insurance companies. The big box designs, plans, and system for financing them. Control of a qualified association with patient members, PPC. Support of an insurer licensed in 48 states. A tech staff that can build on open EMR and on the facility developments. Stop-loss reinsurance from Presidio for our ACO employer health plans. TPA services from HealthSmart. Fulfillment services for our medical benefits program from New Benefits. We have designed and engineered clinics that can be manufactured in a short period of time and put on site within 4 to 6 months. They are higher in quality than facilities that are custom built on site and have the advantage of being able to be placed on shopping center property of other medical properties without deconstruction and massive infrastructure development. The clinics can be configured for a small primary care practice or for a large multi-specialty practice. We aim for as many medical homes and neighborhoods as possible, and this design provides for a clinic meeting space for patient education and living quarters for the physician and nurse that serve the patient members. This is a big box of which many have become available from the retail stores. They are usually in good shopping center locations and provide needed infrastructure to repurpose them for medical uses. They can be turned into clinics and acute care hospitals for about 40% less than the usual cost of a new medical facility on vacant land. These big boxes are not easy to rent to retail stores because they are too big. But as you can see, they are easy to redesign into medical space. They will look good in the shopping center and will be a marketing tool for the medical practices. Adding a small acute care hospital to the big box is not a problem, as can be seen in this picture. When the patient population needs a general hospital, then this design will add safety and flexibility to our total healthcare system. An important part of patient safety is being able to keep people who have infections or may be carrying pathogens away from patients and staff that could be harmed by exposure. We have designed the bed areas of our hospitals so that the flows of patients and visitors are separated from the flow of medical staff and equipment. We totally control access to each room and to each patient. We call it a garden hospital design. If you could see our physical system from an airplane, it would look like this when we reach a patient population of 150,000. That size population would produce revenue of $1 billion per year, nearly 10 times as much as the cost of leasing the facilities.